One of the most common questions that I'm asked is, how does a low carb, good fat diet help anybody with diabetes? I mean, does this kind of a dietary intervention really work to bring down sugar levels? The food you eat must be broken down before it can be used. Your body does not recognize the khichdi you ate or the rajma chawal you had or the salad you're eating. All the body knows are three classes of macronutrients, and these are carbohydrates, proteins, and fats. It breaks these nutrients down into familiar forms before using them. Carbohydrates are foods like vegetables, fruit, rice, or bread, and these break down into sugar in the body. Fats, like oil, nuts, butter, ghee, coconut, they break down into fatty acids. And finally, protein like a dal, a fish, a chicken, converts into amino acids in the body. After food is digested, these three substances, which is sugar, fatty acids, and amino acids, need to move from your intestine into your bloodstream and finally into your cells before they can be used. In this video, I'm going to just focus on two of them, which is sugar, also called glucose, and fatty acids. To help move the sugar from your blood stream into your cell so that it can be used for energy, the body needs insulin. Insulin is a hormone produced by your pancreas. Now, in people with type 2 diabetes, there are two issues the body faces. Number one, there's a drop in the production of insulin by the pancreas called insulin deficiency. And secondly, the body struggles to use whatever insulin is being produced, and this is called insulin resistance. As a result, either there is not enough insulin in the body, or whatever insulin has been produced is not sensitive enough to realize that there's sugar in the blood that needs to be moved into the cell. So the sugar continues to stay in continues to stay in the blood, which is why people with diabetes have difficulty in maintaining blood sugar levels at a normal range. If you remember at the beginning of this video, I said carbohydrates break down into sugar in your body. So the more carbohydrate eaten in a meal, the more sugar that is going to be absorbed into the bloodstream, and the higher your blood sugar levels will be. While every diabetic knows sugar as in white sugar is bad, and therefore you stay off mithai, you say no to desserts, most of what you think is healthy, such as fruit, is actually a lot of sugar. And many people don't know starchy carbohydrate foods like bread, like a paratha, like rice or pasta or potatoes quickly turn into sugar when you digest them. Did you know eating a potato, like a cup of potato, vegetable, sabzi, or one aloo tikki, raises your blood sugar level as much as eating 9 teaspoons of sugar? That's why for people with diabetes, pre-diabetes, borderline diabetes, or even PCOS, we don't allow them to eat carbohydrates. At best, it's a very limited amount. Unfortunately, in Indian meals, where the rice or the roti sits at the center of a plate, they tend to be very high in carbs. Now, am I asking you to stop eating what you've eaten all these years? Of course not. All I'd like you to do is to gradually cut down on those culprits. So if you're used to eating 3 rotis at lunch, cut them down to 2 before you move to 1. And if you're a rice eater who enjoys a cup or 2 of rice with dal or sambar, bring them down to half the quantity. I'm sure you're going to ask me, how on earth am I going to satisfy that hunger or anger? Let me add, I have no intention of starving you. I'd like you to replace that rice or roti with a vegetable and dal. So if you're used to having 1 cup of dal and vegetable, make it 2. So you will end up eating as much as you did before, except now you've lowered the overall carbohydrate load on the body, and you will not spike your blood sugar. My second chat with you is about fatty acids. Here's a surprising fact. Dietary fats do not have an effect on blood sugar. So when you eat the eggs, or when you're having, applying some lovely ghee to your roti or rice, enjoying a coconut curry or some, fish like rohu, rawas, an afternoon snack which has almonds and walnuts, they do not raise your sugar level. In fact, research has shown that almost 5,000 adults helped control their diabetes, blood sugar and insulin levels by having a diet of good fats. And this is exactly what we do with clients at Sepalika. Adding a good fat to your diet is a big part of the recommendation that will come from us. So here's my final take. Enjoy your carbohydrates, but go moderate with them. Enjoy your fats without the guilt, and watch your blood sugar levels come down naturally with minimal dependence on medication, just with the magic of food.